I'm glad to be here today to preside over the commemoration of the World Suicide Prevention Day. This day is organized annually by the International Association for Suicide Prevention and observed globally. The purpose is to raise awareness that death by suicide can be prevented. Globally, over 800,000 people die due to suicide each year. It is the second leading cause of death for young people aged between 15 and 29 years, the most productive age cohort within our society. In 2013, the Mental Action Plan 2013-2020 was adopted by the World Health Assembly. This action outlines suicide prevention as a priority, with the global target of reducing the rate of suicide in countries by 10% by 2020. We are already in 2020, almost moving towards the end of 2020, and I think we need to reflect back and see whether we have achieved that target. In the Sustainable Development Goals for 2030, suicide is a proposed indicator of health for some of the health targets. And this target aims to reduce premature mortality by 1/3 from non-communicable diseases through prevention and treatment and promotion of mental health well-being. Fellow Kenyans, here in Kenya, the number of suicide cases have increased in the last several years. A report by the World Health Organization indicated that the number of suicides reported in the country rose by 58% between 2008 and 2017. There are 317 suicide cases reported every year, although this morning I read in the newspaper a figure of 421. Still a large number for this country to report every year. The increased reported cases of suicide in Kenya shows the dire need for measures to prevent suicide. The World Population Review ranks Kenya at position 114 among 175 countries with the highest suicide rate. In addition, Kenya's suicide rate is at least 6.5 suicides per 100,000 people. The Ministry of Health is in the process of developing a national suicide prevention strategy and program 2021 to 2026 in line with the WHO guidelines. In response to the current COVID-19 pandemic, the Ministry of Health is providing mental health and psychosocial support as a key intervention in this response. During a crisis like COVID-19, most people will experience some degree of distress, such as feelings of anxiety, hopelessness, sadness, difficulty in sleeping, fatigue, irritability, or anger, and aches and pains. Although individuals respond differently, this is normal, and for the majority, it will improve and go away over time without any need for medical intervention. However, some of those affected may suffer from serious mental or emotional distress, including worsening of existing mental illness or resorting to substance abuse and substance abuse problems or acute stress disorder. A public health approach is therefore needed to address the psychosocial and mental health consequences of COVID-19. Fellow Kenyans, His Excellency the President, during his Madaraka Day address in June 2019, highlighted the growing concern on the increased cases of depression and the need for efforts to address the mental well-being of the Kenyan population. There have been persistent requests by Parliament as well and the general public for a national suicide response, including a national suicide strategy and a suicide hotline, hence the need for this intervention. One of the interventions to effectively address the growing need for mental health and psychosocial support for persons who are infected or affected by COVID-19, as well as the general population, is the provision of telecounseling and telepsychiatric services. And of course, during this period of COVID-19 pandemic, where we are encouraging social and physical distancing, the element of tele-services becomes very critical. I'm made to understand that even at the ministry and here at Madare, we are considering setting up a telecounseling and telepsychiatry center here, which will also have a call center that will have suicide prevention hotline numbers that Kenyans can call into, receive counseling and guidance, and directions and instructions on where to seek appropriate care and for the conditions. The suicide prevention hotline will be a toll-free line, and many Kenyans will have access to it for mental health and psychosocial support. This 24/7 facility will enable the adequate utilization of the scarce human resource for mental health and psychosocial support. Callers will receive both emergency and non-emergency support. The hotline will be operational and continue to be operational post-pandemic to address mental health impact of COVID-19, not only mental health impact of COVID-19 on the population, but all other mental health challenges that we face as a nation. It will also enable follow-up of persons diagnosed with mental health problems or substance use disorders. Trained mental health personnel, including nurses and doctors, have been identified who will be on call and will work in shifts at this telecounseling and telepsychiatry center. These cadres will run the call center even as we await the deployment of the 40 psychologists who are currently in the process of being recruited through the Public Service Commission. The telecounseling and telepsychiatry center will also deal with other mental health issues, as I mentioned earlier, including attempted suicide, substance use disorders, crises such as drug overdose, psychosis crisis, and gender-based violence. It is expected that it will offer psychosocial support, including psychological first aid to persons in quarantine sites, currently healthcare workers, other frontline workers including morticians, persons with COVID-19 and their families, persons in recovery, families of the bereaved, survivors of gender-based violence, and the general public. They will also provide technical mental health care support to counties and healthcare workers, offer psychiatric consultation, public education on good mental health practices, and coping strategies. Besides, there will be linkage to ambulance services for response to mental health emergencies. Having said that, I also want to take this opportunity to thank all those healthcare workers whose day-to-day work involves taking care of mental health patients, addressing mental health issues in this country.